I went to a vet conference, so you don't have to. I'm currently at the Western Veterinary Conference in Las Vegas, Nevada. I'm having a great time, but I thought I would take a moment to share some of the cool things that I have learned. And this one is on the safety of long-term NSAID use, anti-inflammatory use, in dogs with chronic arthritic pain. And basically, I hear all the time that owners are really worried about starting their older dog on NSAIDs because I tell them it's likely going to be a long-term solution, a medication, and they think that long-term NSAID use has a really high risk of side effects. And honestly, I've kind of agreed with them. I've been like, yeah, there's that risk, but I think the quality of life improvements outweigh the risks at this point most of the time. That's usually the conversation I have. But it was interesting because there was these two studies that I'll link in the comments that showed that the long-term risk of adverse effects of long-term NSAID use are actually exceedingly low. And if you are to see side effects, it almost always happens within the first month of use. So that's why we are supposed to recommend pre-blood work and then recheck the labs in 1 month just to make sure that liver and kidney values have stayed the same. The other thing too is that they said if you intervene early and stop a dog once you see the first signs of side effects, it has an exceedingly low rate of becoming a bigger issue for the dog. They said instead of waiting until the dog is vomiting, the owner should call you if the dog is not eating, because that is the most common side effect that we see. So I thought that was really interesting, and I'm excited to have another talking point with the owners to put their minds at ease with starting their dog on NSAIDs, because it is one of the biggest things that we can do for an older dog's quality of life if they have arthritic pain. What do you guys think?